right, thanks.
Good morning, 102.7, 103.5, WICY, your feel-good favorites from the 80s and more. Dr. Todd Whitman is with me right now as we dive inside the community with those from Hyde Medical Center. Todd, how you been, man?
I'm well. How are you today?
Excelente. Just another morning here as we now sit very close to August. It's crazy to think that we're, at least up in the North Country, it feels a lot like it did even 3 months ago, except maybe a few more businesses open, huh?
Yeah, exactly. Although it feels like we're moving in the right direction continually here. Watching other parts of the country keeps in mind how important it is that we continue to do the things we're doing.
Yeah, we kind of need to separate ourselves from them as we have because, you know, it's important to realize that we still want to keep economies going out here as much as possible. Some businesses still don't have the fortune of being able to open right now, and I feel for some of those. But
I do as well.
Yeah, just want to and they understand, you know, that they're waiting for the guidelines. But we'll get to this right now. I heard there's a new network-wide electronic health record thing going on with you guys.
There is. So UVM Health Network has made a big investment, over $150 million, in a network-wide health record called Epic. And in Malone will be implemented in the third wave of the Epic implementation, which will occur in November of 2021. It's really exciting stuff, John. The 7 network hospitals and affiliates will have one record where, regardless of what type of care you're receiving, whether at your primary care doctor's office, if you're with a specialist in the hospital, or even in an emergency room, your providers will be able to see all of your medical history, your medications, your allergies, which is important, all your old lab results, radiology tests.
Are we talking like a central hub kind of a deal here that's just going to encompass everything? That's what we're looking for, huh?
You got it. So no matter where you go, everybody will have your information. It'll, reduce duplicate tests, make it much easier for providers to share patients. It'll be really fantastic for our community. So we're excited in Malone to be in the next phase.
And when can we get maybe more detailed information if people are curious, or where also?
Yeah, so our website may have some information. We're going to be rolling out a lot more community education around this as we get closer. Right now, we're just in the process of developing workflows and working with our providers to get them educated on the process.
Sure. Well, thank you for that. And one last thing we'll talk about here is telehealth. It's been a thing now for many months, ever since COVID-19 became really a big thing. And how are providers trying to, innovate and bring that to the community as well?
So it's a great question. So, during COVID, it was all we had, so we learned very quickly how to use it under those circumstances. But now the providers in Malone are really working together to try and reimagine how we can utilize the different types of telehealth and improve patients' care. So we're hoping that in the near future we can start to implement that more often than we have been in just the last month or so. We very quickly got back to our old routines. And we want to make sure that we have this available for people in the future. So if people are interested in telehealth, if you'd like your visit to be via televideo or other telehealth applications, please just let your providers know, and we'd love to get the community involved in this.
Sure thing. Dr. Todd Whitman with us from Hyde Medical Center. Todd, thank you again, and we'll be talking either next week or in a couple of weeks, right?
Sounds like a plan.
All right, my man. Take it easy.
Have a good one.
102.7, 103.5, WICY, feel good tunes of the 80s and more inside the community as we always are.